When treating my patients, I take a whole health approach. As a dentist, I can't do this alone. I rely on a lot of other specialists to help treat my patients as a team approach. Whether that's the ENT that needs to help with the tonsils and adenoids that are inflamed, or the myofunctional therapist that needs to help with the tongue function. Pediatricians are so important because they could be the first ones that can identify and screen patients that have the likelihood of having a sleep disordered breathing issue. When talking to a patient and getting to know their health issues, it's very important to get the rest of their doctors on board to make sure that they're being treated comprehensively. Adults that have a compromised airway are more likely to have other health issues, such as high blood pressure, acid reflux, or inflammation in their body. In adults that have high blood pressure, acid reflux, and tooth wear, they almost always have a correlated sleep disordered breathing, such as snoring or apnea. Inflammation is a hot topic, and it really increases your chance of having all other systemic diseases such as cancers, strokes, Alzheimer's, dementia, cardiac issues, and not breathing properly is very pro-inflammatory. So with children, the challenge is that they're also different, and a lot of times when we see a child, we think that that's just how they are, or they're like their parents, and they look like their parents when they have a long face or a set back jaw, and we're taught to think that's just a characteristic. But a lot of times, what may just look like a personality flaw is actually an airway issue and a growth issue. When we see a child, we need to look at their airway, look at how their jaws are growing and their tongue position and their breathing, and realizing that if a child's acting out or they have chronic allergies, it might be something anatomically that's limiting them. I believe that every child deserves to be the best version of themselves, and we never get that best version if their airways are compromised. Even when a child comes into this world with all the tools they need to be successful, it can be simply environmental allergies and toxins and pollutants that cause them to have issues in their growth. So when they have an allergy or they're chronically sick, they can't breathe through their nose. Once that nose is congested, they start building the habit of mouth breathing. Now when they're mouth breathing, that tongue is sitting low in their mouth and not putting positive pressure on the roof of the mouth the way it should. This then leads to underdevelopment in that upper jaw, underdevelopment in the lower jaw, and then underdevelopment in the airway. This vicious cycle continues because now with this smaller airway, underdeveloped jaw, this child continues to have chronic nasal inflammation and cannot breathe through their nose. And until we get them breathing through their nose with their tongue in the proper position, they're not going to grow and develop the way that they should. Research has shown that up to 50% of children diagnosed with ADHD actually have a form of sleep disordered breathing. Kids that are just not behaving the way that they should because they literally are struggling to breathe every single day. So when a patient has sleep apnea, it's not just the snoring noise and the choking at night, but it's going to affect their entire body. So when we're going through a sleep study, we see that when they have a choking episode, that is associated with a decrease in blood oxygen level as well as an increase in heart rate. So that does a lot of things to our body that's not healthy. That decrease in oxygen in our bloodstream means decreased oxygen to all of our organs. The cardiac issues associated with that elevated blood pressure, these patients are not resting at night the way that they should. So instead of their heart rate being nice and low and relaxed, they're working out in their sleep and their heart rate is elevated, and that's not good for their heart, it's not good for their blood pressure, it increases their risk of stroke and heart attack. Please follow me and watch more of my videos.